What's the correlation between lower levels of hormones in women and men and their mental health, depression, swing in moods? Yeah.
That's such a good question. I got chills just hearing that question because there is a greater emphasis on the correlation between a lack of testosterone and an increase in depressive symptoms. Now, when we look at depression, right, it's such a broad category. What is depression? Depression to me is me not feeling like myself and feeling low. And for anybody, that can be so many different symptoms, right? It doesn't have to be the classic textbook depression that the person is not going out as many times as they want to, crying all the time. Sometimes depression is just apathy also. So I think you notice when you start listening to patients about how they feel, you notice the vast array of symptomatology which require the same treatment, which is replacement and ensuring that testosterone is replaced appropriately. The moment you replace testosterone in a woman whose receptors have not had any, it's like a light switch. They immediately feel like clearer. The mood elevates. As I said previously, testosterone is a happy hormone. It's actually an anti-anxiolytic. There are studies that show how it correlates directly to creating better mood for patients, men and women. And I mean, I'm going to have Tony come and on our podcast, which is going to launch 2026. Shameless plug. Shameless plug. Stay Young podcast coming soon. But my fiance can talk, and he's a testament to this. Somebody who's very high strung, high functioning, an attorney, a litigator for Morgan and Morgan. Size matters. That's their slogan. So it's a monumental difference. And I think next time Danny's here, I'm going to make sure he's here to speak on it, because when you see the patient experience is when you believe it. Because there's so much misinformation and misrepresentation of data that you have to experience it to understand what it feels like. So when I hear over and over again patients say, I can run again. I'm waking up at 5 a.m. I have energy. I feel clearer. My muscle health has improved. I feel like I'm toning. I'm losing that stubborn fat that I wasn't able to lose. What else is health and wellness? What else is vitality? What else is elevating mood and improving mental health, right? So the question of mental health is, we have a mental health crisis, right? Because we need more providers to be able to listen to patients for what they need, instead of trying to fit them into a box and a diagnosis, but listening to patients and actually telling them where they stand, right? I think every assessment, and there's so many different gaps in medical assessment, like when's the last time you went to your internist and they checked your flexibility and your strength? I'd love to hear comments on this. DM below, please. There are so many gaps in physical examination for overall health assessment. Mental health is one that is completely overlooked, and sexual health completely overlooked, because we've stigmatized the idea about talking about sex, but you can talk about sex health and not sexualize it, right? Because it's such a part of life. Human beings want connection. They want to have good sex. They want to be happy. They want to have good mood. They want to have good energy. They want to look good. So these are all normalized things. And with your doctor, you should be able to openly engage in that conversation. And I think for us, we feel privileged to have a space where women and men can come in and openly talk to us, talk to Gabriella, talk to Nancy, and talk to myself about their symptoms openly and say, I have this problem, what can I do? Because there are solutions as we are becoming innovative with peptide therapies and hormonal therapies, right? You can easily replace those hormones. And then women are frequently afraid, like, do I have to inject testosterone? No. You can take it as a cream and you can take it as an oral troche. And we find the best way for it to fit your lifestyle. It doesn't have to be injectable. You could do injectable. Some women do well on injectable. Every patient is different, and we have to tailor and personalize those treatments. But in my experience, even as a young doctor, when I came out of residency and I was prescribing SSRIs, you don't have to be a psychiatrist to give a patient an SSRI, even though your evaluation should more properly and cohesively be through psychiatry. But as an internist, I have prescribed SSRIs for patients to provide more comprehensive care and speak and consult with my colleagues on which SSRI should fit their mold, or which genetic test will tell me which SSRI will best fit them. But now I look back on those cases and I'm like, maybe that needed a hormone assessment, right? When I wasn't practicing hormonal care, because my medical education didn't teach me any of this. I graduated medical school not knowing anything about women's hormones. I knew about endocrinologic care. I knew about thyroid replacement, which I can do, which internal medicine does. But now I look at it and I'm like, that's malpractice. So I urge providers to further their careers and further themselves to be good enough to treat patients in the community. It is our ethical obligation to be able to answer these questions. And it's okay if it's not your thing. Defer to somebody that is. Don't tell a patient you don't need testosterone, because they might, and it might save their life.